Support for this program is provided by the Foundation for Excellence in Louisiana Public Broadcasting and from viewers like you.
Hello and welcome to Louisiana Public Square. I'm Beth Courtney, president of LPB, and joining us to moderate tonight's discussion about suicide prevention is LPB's news anchor, Andre Morrow. Andre.
Beth, thank you. Such a tough topic. Suicide, it's a topic that many feel uncomfortable talking about. That's one reason it does not get a lot of attention. It's often kept in the shadows until it's thrust into our consciousness. High-profile suicides like that of fashion designer Kate Spade and celebrity chef Anthony Bourdain will put a spotlight on the issue for a time anyway. Yet suicide is the 10th leading cause of death overall in the U.S.
Well, Andre, in Louisiana, on average, one person dies every 13 hours from suicide. But there is hope, and prevention is possible. If someone is in crisis, there's a national lifeline to call, which we'll be sharing throughout the program. And friends and family members can look for warning signs that often indicate a loved one needs assistance. Over the next hour, we'll hear personal stories of loss and courage and methods that help in preventing suicide. First, an overview. A flood of emotions overcame Emma Benoit the morning of June 7th, 2017.
I thought that if Emma Benoit is gone, then no one has to think about her anymore. No one has to worry about her anymore. You know, she's gone and that's it.
The 16-year-old from Ascension Parish attempted to take her life with a firearm.
I found the gun and I looked up how to cock it on YouTube.
Benoit survived, and despite limited use of her legs, she's growing stronger daily and sharing her story to help others.
I just feel like going through everything that I'm going through and have been through, it will be a waste to just not use it to help people and use it for good.
While suicide is the 11th leading cause of death in Louisiana, for persons aged 15 to 34, it ranks number 3. Barney Lejeune's daughter took her life on Memorial Day in 2014.
Never forget that day. Andrea was 27 years old. She was a college graduate, had been struggling with mental illness, with bipolar disorder for about 12 years. But she took her life with a firearm.
Lejeune is now the executive director of Jacob Crouch Suicide Prevention Services, named after a ULL student who took his life in 2005. The group provides training on how to identify and respond to the warning signs of suicide. Their reach includes portions of central Louisiana where suicide rates exceed the national average.
Avoyles Parish and Evangeline Parish have a rate that's more than the national rate, more than double the national rate. It's probably 28 or 29, which is more than double the national rate. So it seems as though suicide many times is, in the rural areas, it's a lot worse.
Following the death of Lejeune's daughter, he also discovered a gap in support services for family members affected by suicide. By partnering with the Diocese of Lafayette, the Jacob Crouch organization now helps fill that void in Lafayette and St. Landry parishes.
Each support group, we have a licensed counselor that facilitates the group, and then a survivor, someone that's lost a loved one, as a co-facilitator.
Family members of suicide victims at the Baton Rouge Crisis Intervention Center honor their loved ones by creating memory quilts. The activity is one way of dealing with the grief and unique stigma surrounding this type of death.
People don't commit cancer. They don't commit heart attacks. They die by cancer. They die by heart attack. They die by suicide. It's a cause of death. And that cause of death shouldn't erase their life, but it does. The stigma that is assigned to this cause of death has people then look at their family, loved ones, and friends with a crooked eye.
Dr. Campbell is a suicidologist and was director of the Crisis Center for nearly 20 years. He says while every case is unique, people at high risk of suicide may exhibit warning signs like changes in their personality, eating and sleeping habits. Prevention begins with finding out why they are hurting and offering support with an open mind.
Within a person having thoughts of suicide, they're ambivalent. There's a part of them that wants to live, and there's a part of them that wants to die. And they're competing for that person's attention. If we let the dying side talk in a non-judgmental environment where we can listen and support, it loses power.
Once a suicidal person verbalizes their intention, it loses its strength.
When they start talking, they hear themselves for the first time. Because up till now, it's been in their head. When they speak it out loud, it sounds different. And people routinely say, I can't believe I'm even thinking like this.
Of Louisiana's 677 suicides in 2016, 16% were military veterans.
We know that for about every 120 Americans who die by suicide every day, that about 20 of those are veterans. And we know that veterans' risks are particularly higher if they do not come to the VA to get care.
April Foreman is a licensed psychologist with the Southeast Louisiana Veterans Healthcare System. While veterans face the common stressors of relationship and employment challenges, their wounds of war can hinder their coping skills.
Some of my veterans have experienced traumatic brain injury, and that really can disrupt your brain's ability to cope or to deal with sort of stressors. And they may have difficulty with mood. They may be at more risk for substance use, which increases your risk, and homelessness, which increases your risk.
While suicide risks for the general population continue to rise, for veterans receiving VA care in Louisiana, those numbers have stabilized. Suicidal veterans and even concerned family members should contact the National Suicide Prevention Line and then press 1.
We follow up all calls from the Veterans Crisis Line within 1 business day of receiving them. And if they're not enrolled in care, we get them enrolled in care. If they're at high risk for suicide, we track their care and we follow their case for a long time. Our compliance for responding to calls within a business day has been 100%. And we are the largest VA that has been able to maintain that compliance rate.
Campbell says we must remember that suicide is preventable.
We know that if we give people the help they need, even after an attempt, they might live a life. 6 out of 7 will never die by suicide if they get the help that helps them.
Joining us now to discuss suicide prevention is our audience. We have mental health professionals who specialize in this field. We have parents who have lost children to suicide. And we also have 3 high school students from the Legislative Youth Advisory Council. They're here tonight from Shreveport, from Jena, and from Baton Rouge. We want to welcome everyone for being with us. Before we get to our discussion, let's review some facts on suicide compiled by the American Foundation for Suicide Prevention. On average, there are 123 suicides per day in America. Now, while the national suicide rate is 13 suicides per 100,000 people in Louisiana, the rate is 14 per 100,000. Nearly 4 times as many people die in Louisiana by suicide than HIV. Nationally, men die by suicide nearly 4 times more often than women, and white men accounted for 70% of suicides in 2016. The rate of suicide is highest among those who are middle-aged. Guns were used in 51% of all suicides in the year 2016. Now that we have heard some of that data, let's put a human face to these numbers. In our audience tonight, we have with us people who've been forced to deal with suicide in one way or another because of the loss of a son or daughter, health professionals trained in suicide prevention, and students with an interest in this often hushed subject. Let me begin first with Mr. Lejeune. We saw you in that piece, and we know a little bit about your story, but if you would reintroduce yourself and let us know what's on your heart tonight.
I'm Barney Lejeune. We lost our daughter, our only child, to suicide in 2014. As I mentioned, Andrea was 27, and after her death, I recognized how much suicide is a crisis in America. So I have been focusing all my resources on trying to prevent suicide and bringing help and healing to those who have lost loved ones to suicide.
This is something that you didn't prepare or plan for in life. It was thrust upon you.
Absolutely. It's not on my radar. Absolutely.
Others in that same situation, sir?
My name is Alan Randall. In 2015, I lost my son Jesse Randall by suicide. He was 24. He had gotten depressed, and we had even talked about it. And last time I saw him was Easter Sunday, and we talked about his depression, and he said he was going to be okay, you know, and I trusted him that he was telling me the truth, and he gave me a hug like he always did before he left and said, "I love you, Pops," and I said, "I love you too, son." And he left, and 2 days later he took his own life. Jesse was, like I said, he was 24 years old, young man. He had everything going for him, and he had a tattoo that said, "For you I will." And when he got that tattoo, I said, "What does that mean, son?" He said, "For you I will, Dad." He said, "If you need something done, I'll do it." And that's how he lived his life, was helping people. And now that's how I live my life, and I have the same tattoo on my wrist now, "For you I will." I'm his voice and the voice of others who's lost their life to suicide and those that struggle. And that's what I'm committed to, is saving lives.
And Alan, here with you tonight is your wife.
Yes, sir.
Sitting next to you, Renee.
Yes.
Jesse was my heart. And it's still hard. But I'm trying to help him do what we want to do so nobody else has to go through this. We just take one day at a time. That's all we can do.
I mean, there's death from natural causes, from
yeah.
accidents. Suicide is an entirely different category.
Absolutely.
You never think about it. You never think my kid's gonna do that. It never crosses your mind. Never. Even to this day, I can sit in my chair and just think, "Son, why? Just come to Mom and Dad. We would have helped you do whatever you needed to be done." He knew he could come talk to us, but he didn't. He was so proud of what he had accomplished. He didn't go to nobody. None of his people he usually goes and talks to, he didn't go talk to anybody. It was like, I think in my heart, I think he had it planned out. Because I think that's why we invited him to come eat like that. He was off like Tuesday and Thursday, and we asked him to come eat Tuesday. He said, "Maybe Thursday, Dad." But Tuesday night's the night he killed himself.
You know, there could be somebody watching this program right now who is contemplating suicide. Let's talk to some of our professionals here in the audience. Anthony, if you'd introduce yourself and speak to us.
Yes, I'm Anthony Germain, Executive Director of NAMI Louisiana, which is the National Alliance on Mental Illness.
And what is the chief work that NAMI does?
Our primary work that we do is advocacy at the Capitol and community outreach and training programs. We try to help people who maybe have limited access to clinical help and professional help. So we help train average family members on how to deal with loved ones who have some type of mental illness.
Let's bring in some of the students who are here with us. Stephen?
My name is Stephen Ajay, and I'm from Baton Rouge University Laboratory School. I am here because this is a very big problem. I've never actually been affected by suicide in the past, or like victims of suicide, but it's a very, very sad thing to undergo. There are many different things that cause it, and we're not really sure what to do, because like there's just like so many factors that tie into suicide.
I know that you're mentioning the difficulty, the beyond comprehension, the difficulty of going through it, and you sir mentioned that you and your son, you had spoken, but before that you didn't really think about it. So suicide is not something that we sit around thinking about until it happens to us. Robin?
My name is Robin Mulder. Last year on June 27th, my son Lucas shot himself. He was 25, a recent graduate from LSU, had no substance abuse problems, no diagnosed mental problems. Had dinner or lunch with him for Father's Day a week and a half before, and he talked about plans he had for things he was going to do. We knew he had contemplated suicide. We had arranged for him to get counseling, but we didn't do enough. Afterwards, you think of everything you could have tried to do and didn't. Don't leave any stone unturned. If you have any reason to think someone is going to commit suicide, push them. Don't take no for an answer. Don't let them off. Don't let yourself off.
April, we saw you in the piece. What is it about suicide that makes it such a hushed topic?
There's been so much stigma around mental health, and there's something about the story we've been telling about suicide, that people who die by suicide, like that's this deeply deliberative choice that they're making, and maybe sometimes that's the case, but in fact, usually when people die by suicide, they're in a very short-term impaired state, and so we're not telling the story of this is a person who is very, very impaired and very, just very sick in a moment. We're telling the story like maybe, maybe this is a choice that they made or something that they did to themselves, maybe something that they did to me, and people's feelings are so painful that it's really hard. People feel so much guilt and so much stress that they actively don't mention it. When someone dies from cancer, there is a lot of donation, right, to the American Cancer Society or Susan J. Komen or something like that. But when someone dies by suicide, what do you talk about? What story have we given you that allows you to feel like there's something you can do or something you can advocate for? And it's, we're changing that, but historically it's been really hard.
Yeah, it's hard. It's hard for the survivors. It's difficult for everyone involved. Let me hear from you, Sarah, and if you'd introduce yourself.
Yes, I'm Sarah Pardue-Bourgeois. I'm from Hammond. Like Stephen said, I haven't personally been impacted by the suicide of a loved one, but I can tell just from the people that I do know who have that it's just a hard struggle to have to cope with it, and a lot of people aren't sure how. And you can just see from the statistics how many people are actually committing suicide or attempting suicide, and I think it's an epidemic that should be addressed.
Jerry, let me talk to you right now and hear your story.
Well, I'm fortunate in that my son, who's a veteran, came home from overseas after his service, and several of his friends committed suicide, and a few months later he tried to commit suicide by police. A few days prior to it, I knew something had changed. He was very calm and resigned, and fortunately, law enforcement here has been trained in crisis intervention techniques, and hopefully that's something that's happening in every city across Louisiana. So law enforcement, when they come to a scene where somebody's attempting to take their lives, will know how to de-escalate that. And in some cases, sometimes it's just great police work, but sometimes it is a few seconds that they are able to pause and save that person's life. And in that case, my son's life was saved, but it didn't end there. And being a vet, it's an ongoing challenge to get care, to be diagnosed, and finding out and getting information from NAMI, from other organizations or nonprofits that can educate family members especially about what they can do to get additional treatment, where they can go. There aren't a whole lot of beds out there for treatment, VA or otherwise, so it's real important that family members get educated on what they can do and do as much as they can. Sometimes that's not successful, but every day's a struggle. Many other mothers that I know that I talk to who are in similar situations talk about that when their children share their ideations about suicide, how difficult it is sometimes to even walk in the house, because you never know what you're going to find, but to keep doing it and keep getting educated.
One thing I'm hearing is that we as a society need to step forward with this topic and be open about it and discuss it. Well, that's all the time we have for this portion of our show, but much more to come. When we return, we're going to be joined by our panel of experts to further explore suicide prevention. Welcome back, everyone, to Louisiana Public Square. Tonight we are discussing the prevention of suicide. And joining us now is our panel of experts. Danita LeBlanc is the State Suicide Prevention Coordinator for the Louisiana Department of Health. She has worked in suicide prevention throughout most of her career and is certified as a trainer in several intervention programs. Also with us, Raymond Tucker, a clinical psychologist and assistant professor of psychology at LSU. He is founder of the LSU Mitigation of Suicidal Behavior Research Lab and also trains medical staff and students in suicide-specific assessment and intervention protocols. Tanja Miles is an ordained minister, a veteran, a certified peer support specialist, a suicide survivor. Miles was recognized by George W. Bush, president, back in 2003 for her personal perseverance in recovery and the work that she does in our community. And also with us, Cynthia Elmer is board chair of the Louisiana American Foundation for Suicide Prevention and a member of its National Leadership Council. She became involved with the organization after losing her son, Kevin, to suicide in 2004. Now, before we go to our audience questions, of which we have many, I'd like for each of you to briefly tell us from your perspective, what is the biggest misconception about suicide? Biggest misconception? Danita, I'll start with you.
I think the biggest fear people have is that if we talk about suicide and ask about suicide, that we're somehow putting the idea in somebody's head. And the fact is, we're not that powerful, and they're generally already thinking about it.
All right.
Absolutely. I think one that I hear often is that suicide is caused by one thing. And maybe the thing that I hear the most is that suicide is just a bad case of depression. And what we've found is that, suicide can occur, and many suicides occur when depression symptoms are there, but the vast majority of folks who experience depression don't go on to attempt or die by suicide. For example, the Center of Disease Control and Prevention estimates that there's somewhere around 15 to 16 million episodes of depression in the United States each year, but we lose about 45,000 people to suicide. There's something else going on there. And so when we hear of one thing being the cause of suicide, that's often a misconception.
And Raymond, you're doing extensive research in detail. We'll hear more about that Absolutely. In just a moment. Tanja, Miles?
I guess one of the biggest misconceptions that I hear all the time is that you can pray suicide away, or you can pray mental health away. I'm a licensed ordained minister. I do have a diagnosis of PTSD, like you said earlier, two-time suicide survivor.
Two-time suicide survivor?
The first time I was 13, ended up getting my stomach pumped. The next time I was 18, and I ended up in a mental hospital. The thing about that is that no one ever asked me, Tanja, what happened to you? They used to always ask me, what the heck is wrong with you? And it was, told to me, just pray it away, just pray it away. And in the faith-based community, we don't talk about suicide prevention or suicide enough, and we have to have that conversation because most people are connected, to the faith-based community. So we have to encourage and educate the faith-based community more.
Okay, and Cynthia Elmer, biggest misconception in your thoughts?
They think that it's not preventable. Suicide is preventable. You have to talk about it and open the lines of communication so that they can see that you are concerned about them, you are interested, and that there is help.
Okay, it's preventable.
Yes.
We've got people who have questions for you, and so I'm going to go to one of our students, a grad student at LSU. Catherine, what is your question for this audience?
My question is, so what are some warning signs that we can look for, either as friends or family members, as a mental health professional? What are some things that we can look for to try to talk to?
Change in their attitudes or change in their appearance. If they're showing up late for work or they're not doing a good job where they usually do a good job, things like this, that's clues.
Yeah, I agree with what she said. I mean, a change in behavior is key. Like I said earlier, people used to always ask me, what the hell is wrong with you? Nobody ever asks what happened to you. And in, different cases, I know people, try to commit suicide. But, a lot of times there's signs of, like she said, their sleep pattern is off. The way they dress, the way they talk.
Raymond, your thoughts?
Absolutely. You may hear thoughts like feeling like life isn't worth living. Maybe they might not say I'm actually suicidal, but just might say something like, I wish I wouldn't wake up tomorrow, or just wish this was all over. Sort of communicating that life is really painful in that moment, and maybe something like suicide could be a relief to that. You'll often hear thoughts like, I feel hopeless, I feel trapped, I feel like life has just beat me down. These sorts of things can also be potentially warning signs for suicide.
Want to hear from everybody. Danita?
Also, things like, in addition to trapped and hopeless and helpless, feelings of being a burden, that people around you are better off without you, and they are often firmly convinced that that is in fact the case. And very often they're in unbearable pain, and they often have some significant loss pretty close to the event. And so all of those together sometimes are cause for concern.
Ebony, give us your full name, tell us where you're from, and your question.
Yes, my name is Ebony Farlow with NAMI, Louisiana. And my question is, as it relates to the African American community, there's a lot of stigma around that because, especially men, because it's just something you don't talk about. My father, he was in the military, and when he came home, he recently was just telling me about his struggle to, come back to life, civilian life. And again, my question is, what measures can we put in place to help just prevent mental illness and prevent, suicide in the African American community, particularly our men, because also that's the third leading cause of death with our African American men.
Well, I talked to the coroner's office just 2 weeks ago, and in Baton Rouge, it's high. It's half of, I think it was 21, and I think half of those were African American men. So now that's on the rise, and they're taking a look at that. But in the African American community, you're right, it's taboo. It's something we don't talk about. We're told to pray. We're told to keep it in the family, and because we keep that, secrets do make us sick. And one of the things that I encourage people to do all the time is talk about it. Let's be open about it. My family didn't want to talk about it. Now we do, because sometimes I still do have suicide ideations, but I do have people, in my path that I can call and talk to. But we got to, make it known in our churches. We have to talk about it in our community. We have to own it, that it's real, that, it's, I know the stats might say it's more more white men, but now we're seeing it on the rise with the African Americans. So we just need to educate and have that conversation with our family.
All right, let's get a question from Anushka, and introduce yourself. Tell us where you're from.
My name's Anushka Singh. I'm from Baton Rouge, Louisiana. I'm 17 years old. My question was, so say that you've recognized the signs like changes in the mood or behavior and things like that. How exactly do you go about helping the person without like overstepping or feeling too pushy?
Don't feel like you're being pushed. Don't feel like that. Feel like you're the only person that can help them. And do what you think. Follow your gut. Talk to them. Ask them, are you thinking about killing yourself? Are you thinking about suicide? It's not going to give them that idea. The idea's already in their mind. Talk. They're like a tunnel, and when you're going to ask them, are you suicidal? It's going to open the tunnel a little bit so that the light will come in. They're going to see that you are concerned and that you can tell them there is help.
Danita?
One of the definite things to do is ask about suicide, and because it's kind of hard, one way you can do it is, here's what I've noticed. This is what I've seen. This is what I've heard you say. This is what I know. This is what I sense. And sometimes when those things are happening for people, they think about suicide. Is that something that you're thinking about? And it makes for, you didn't pull it out of the air from blue. You're concerned because of the things that you noticed. And asking directly, are you thinking about killing yourself, taking your own life, or suicide? And that's opening the door and giving people permission to say yes, and to talk about what's going on with them, because it is such a stigma that it's very, very hard.
So what's an example of somebody, say you're in a situation, you're at lunch with somebody and you have a feeling that something's going on, how do you direct your question to them?
Literally, like, you don't seem like yourself. I've noticed that you've not been coming, like you've been staying in your office. You're not participating in stuff.
I'm saying, well, yeah, I feel like I'm worthless and I just don't want to go on.
Okay.
What would you say then?
So you are thinking about suicide. Can you tell me more about what's going on that you're thinking that?
So repeat, verbalize what they're saying very specifically.
Right. Very specifically.
Not in any kind of
Code.
hidden
No.
code.
No
No
code.
code.
No code.
Show
Very
that
overt.
you are interested.
No.
In all of your training and all of the research work you're doing, are you finding, what are you finding in this?
Well, certainly from people in the community who are worried about their loved ones, that having the ability to say the words suicide to somebody who might be struggling is often a difficult thing, and people will fear that asking will put the thought in somebody's mind, which we don't have any research to support that idea that we could ask somebody with depression who's not thinking about suicide. That doesn't seem to put that thought in their mind later. I think a lot of times the question isn't asked because they don't know what to do when somebody says yes. And it's really great to know that we have very simple ways of doing this. Are you having thoughts of suicide or killing yourself? I want to be the person you call if you ever are, and I want to help you call the National Suicide Prevention Lifeline. We'll do it together. I'll help you find an appointment. I'll get you in your physician, whatever it is. I just want to be there. And listening, having an open dialogue, letting somebody tell you why they're feeling so bad can be a great support.
I want to hear from one of our high schoolers at this time, because teenagers, often you find teenagers at the end of the rope. Could be drugs, could be depression, could be any number of things. A child takes their own life. Robert, tell us who you are, where you're from, and really what brought you here tonight.
I'm Robert Lawrence. I'm from Shreveport, Louisiana. And I really wanted to know, I know in our high schools and our high school students, we see adults who commit suicide and we focus on that, but we also have a lot of high school students today, in Louisiana specifically, that do contemplate suicide, and some even do go as far as taking their own lives. And I feel like we're not doing enough, specifically with our counselors in these high schools who deal with these students on a daily basis, who see these students walk down the halls. And I feel like, do you believe they are trained effectively to deal with suicide and to talk to someone who is contemplating suicide or is having a mental illness issue that they need to address with an adult, and that maybe they don't feel comfortable bringing to a peer or a parent?
Well, there are programs, of course. That was a question, though, I think. And who do you want to direct that to?
And whichever one folks qualified to answer.
Louisiana passed Act 219 in 2008, and it requires each educator to have at least 2 hours of continuing education on suicide prevention. Every educator in Louisiana should be doing this, getting an introduction to suicide prevention.
But do you feel it's enough?
No, I think it's a beginning. It's an introduction to suicide prevention. We have with AFSP, we have something like Talk Save Lives, which is an introduction to suicide prevention, and then you can go on to Save Talk, which is the 3 or 4 hour. Then you have the Assist training, which is 2 days. There is all kind of avenues for training.
There's also training, Barney, that you're heavily involved with. April, you're heavily involved with. If you would both speak to that.
We do some of the training to the educators, and I feel that it's a cost issue as well, because when it's a cost issue, because when that educator is in a class, they're not teaching. So I think you're working with the legislature. I think there needs to be money appropriated to train these teachers. I know that in Lafayette Parish, many of the educators, many of the counselors had a couple of days of training over the summer, but not every counselor, and I'm pretty certain that isn't statewide. So I think it's a matter of cost, because when the teacher is learning something about suicide prevention, they're not teaching. So does that make sense?
Yes.
And then, you know, she's talking about mandatory training for teachers. There is no mandatory training in graduate school or to have a license as a mental health professional. So I see that you're worried about school counselors, but you can go to a licensed therapist and they could have almost zero training. And the research is really clear that 9 out of 10 licensed counselors wouldn't pass a basic competency exam for training. I work for Veterans Affairs, and last year I worked with the national office, and we trained 356,000 employees. Like that year, well, it was actually in just a few months. And every VA employee gets training every year, and every counselor, every therapist, every clinician gets training every year. That is a lot of training to get. But it's such a big problem. I mean, you're totally right. Like, people are walking around at risk. You expect people in authority who are responsible, when you find someone, like if you talk to your friend who needed help, you would want to know that the person you took them to was ready to help them. And I think, you know, if I were going to ask anything for our future policymakers, is that need for training in mental health is, you would never go to a cardiologist who didn't know CPR. You would absolutely want to ensure that anyone who receives somebody at risk had the training to help them.
Yeah, and I think it's a really poignant question that comes from potentially a point of, let's say, we're looking at one group of professionals to end suicide, like in a school or in the veteran community. And this is a community approach that's going to get us out of this 30% increase that we've seen in the country since 1999. This probably can't be squared on educators in schools. It's partially parents, it's us as peers asking questions, and of course it's legislators supporting increased funds for suicide prevention. So just like when I was saying, suicide doesn't come from one thing. We're probably not going to get ourselves out of this problem with one group of people, just mental health practitioners. It's going to be a large group of folks.
It's going to be everybody.
It's going to
It needs to be everybody, including healthcare providers, because a very large number of folks will see their physician within a year or even 30 days of it taking their own life. And so we do need to do more across more different professions. I will say, though, that the Substance Abuse Mental Health Services Administration has produced several different toolkits, and there's a really good suicide prevention toolkit for schools, that if a school is following all of the recommendations, that school is doing best practices for suicide prevention, and nobody knows that it's there or how to use it.
April, let me ask you this. Anytime I'm looking up something, have a question about something, I Google it, I go online.
Sure.
So there are so many resources online that a teenager who might feel detached from society.
I tell them all to go to Facebook, but they're not there anymore, right?
Okay,
No,
well,
they're not.
wherever they're from, what are the resources online?
So, you know, one of the things that I would want you to think about is keeping the National Suicide Prevention Lifeline number in your phones. And I know using phones for phone calls, if you're under, you know, 18 is kind of weird. I get that. But also there's crisis text line. I'm on the advisory board for that, and you can text 741-741. If you're having thoughts of suicide, but often if you're helping someone, like, you could get coaching for that. And that's something that you could put on your phone right now and sort of set it and forget it, right? Anybody remember that from back in the day? But you could put that on your phone so that if you don't remember, like if someone in our audience is watching us, or if you maybe encounter this in one of your friends, you wouldn't have to remember everything. You could have someone, well, not like this, but someone coach you about what to do. And I think that's a really great way to sort of hack suicide prevention.
We have not heard from Laura yet, so I want to give you a chance to ask your question. And tell us who you are, where you're from.
I'm Laura Peters. I'm from Gina High School. Suicide, especially for my age, has quickly become an epidemic. Many experts would argue that this epidemic is caused by bullying. And many would say, oh, just end bullying, this will solve our problem. But as we all know, ending bullying is easier said than done. So what steps can teachers and students take to help end bullying, which would also help prevent our suicide problem?
Denny, do you want to start first on that?
Bullying is a factor in a lot of teen suicides, but it's not the only reason that youth kill themselves. And a lot of the prevention stuff with bullying has to do with school climate and the whole atmosphere of school. and the way that the school responds. And there's an awful lot of research about what works to prevent suicide. We just never resource it so that schools can do it. I don't know how else to say that.
How do we each individually raise our level of consciousness? Because that's sort of, if we're all taking responsibility. Let me ask you this. How do we collectively, as people, raise our level of consciousness so it does not become a scary, quiet subject?
Well, we
it's out there.
Reduce the stigma. We talk about it. We let people know that there is hope, and that, you know, it's real hope out there, and not to be judgmental, to educate more. Like I said, our families, we got to educate the faith-based community. We don't talk about that enough. We must do that. I see it every day, and you know, that's a lot of times is the first line of defense, you know, so to speak. And I've talked to a lot of different clergies, and they don't know what to do, so it's good to encourage them to have resources, to outsource, to know what the resources are in their community, like NAMI and like Capital Area and other places like that.
I hear you saying encourage, but when you're speaking to clergy, I bet it's strong encouragement.
Oh, it is strong.
I want to hear what you say.
Well, I tell them, you know, I use my own life experience, number one, and dare them to judge
Which is
me.
Powerful, yeah.
Yes, and you know, from there, you know, say that there are people in your church that are suffering in silence, and what part do you play in that? And if you don't know what to do, all you have to do is know that there's resources out there, and refer people to those resources. And a lot of times people say, well, you know, they have to be faith-based and things of that nature. That's great. You know, just get them to the help that they need. And first of all, you know, take it serious and don't tell a person, we just gonna pray it away.
All right, we have that. Robin, do you have a question for the experts?
Well, as mentioned, there's more suicides than ever, and it's young men even more so. What has changed in our society? What things are causing healthy young men in the prime of their life to commit suicide?
I think it's what with most people, you know, who commit suicide, and, you know, talking from my life experience, is feeling like there's no hope, like no one will understand, like I'm in this rabbit hole and I can't get out, and I don't want to be a burden. You know, I am hurting, and you know, when it comes to men, it's, you know, you guys are great, we love you, but you know, we can't get you to go to a doctor half the time. So, you know, speaking, you know, real feelings, you know, most of the time I'm talking to men, they're like, you know, I'm just ashamed because I am the man. You know, I do a lot of work in prison and talk to a lot of men in prison, and that's one of the biggest challenges that they talk about, is that, you know, they feel that they're going to be stigmatized because they are men, and they're not supposed to feel that way.
Raymond, when we introduced you, we said LSU Mitigation of Suicidal Behavior Research Lab. That title may have just gone over everyone's head. So what is that? So what is the research learning?
So we can say it's the Mosby Lab for short, if we want to go with an acronym just for ease. We're trying to investigate risk factors for suicide and suicide risk assessment tools that can be used in hospitals and communities to help improve our understanding of who might be at risk for suicide.
So what are some of those people at risk, for example?
Well, I think Robin's question is a great one, and we look at a lot of individual risk factors, things like depression and hopelessness, and we're starting as a research community to look a little bit broader than just what's in the individual, looking at things like poverty, access to lethal means for suicide, particularly firearms. We're looking at things like that might not just be within the individual, but it is a community, it's a system that puts people at risk for suicide. So when we see poverty rates increase, these sorts of things, they track a little bit with rates of suicide. So we're trying to understand those factors better, but if I had an answer for that question, I would make a lot more money than I do. Unfortunately, what we're trying to do is look at new things. We've been doing a lot of the same stuff for 50 years. We've been not using technology. We haven't been reaching out in risk assessment for when people are outside of the hospital. We're trying to do these things more now to not repeat what we've done for decades.
If you listen to advertising, and there are tons of drugs, pharmaceuticals, there's always a long list of risk factors, and many of them, like Shantax include, could lead to thoughts of suicide.
Absolutely.
What about that?
Absolutely. So, I mean, this is one of these ways that we can be educated and informed that some of our medications not only could have these adverse effects, and it's probably very small, right? Even something like Chantix increasing suicidal thoughts in individuals, that's probably a small amount of people, but it's noticeable. Those adverse effects should be known and they should be communicated to us. The same way that other medications could actually be used for overdose, and one of the ways that folks can die by suicide. So even small ways of thinking about how our medications that we take could influence our risk for suicide. In the same way we might speak about owning a firearm and how we store our firearms, we all can play a role in talking to ourselves about how we have those means for suicide, even if we're not suicidal right now. Because if it comes to the point that we became suicidal, our loved ones, our kids, our spouses, sons, daughters, those being there and accessible, and we having a good understanding of how to use them, whether we Google it, whether we've known our whole lifetime, that makes us just at a higher risk. And so those conversations can be really important.
So we know that 20 veterans are dying by suicide every day, roughly. And we know that 6 of those are in VA care, and that's, you know, one of my charges, but 14 of those veterans, they're getting services in the same community as other people who die by suicide. In Louisiana, what are some of the options for veterans who are at risk of suicide who might not come to VA or might not call the crisis line, the Veterans Crisis Line?
I think
that goes to you.
Yeah, you know, just talking to their peers, and because a lot of them are going through the same thing. I know just being, you know, talking to some National Guard units and talking to them about PTSD and things of that nature, and just, you know, making sure that they are communicating with each other. I know the other thing we have on the rise is female suicide. I mean, that's on the rise big time that we don't talk about. I'm talking about veterans. And so, you know, having those conversations, you know, with those veterans, I think, you know, opens up that, you know, line of communication that, you know, hey, look, I'm feeling that way too. You know, let's talk about it, and let's get the help we need.
Danita, as State Suicide Prevention Coordinator for the State Department of Health, that's a big title, isn't it? That's a lot of stress right there, but a lot of information that you need to get out and articulate.
A lot to get out, and I really work to get people who are working in suicide prevention working together and knowing about each other. And one project or pilot project American Red Cross did recently was they were doing suicide prevention intervention classes in communities, because the military folks and the reservists go back to their communities. So Red Cross was coming into communities, training clergy and people, family members of folks who were coming back from military service or currently doing it. And so we partnered with Army National Guard, American Red Cross, Office of Behavioral Health, and VA in 2 or 3 different places. And so we were able to train like 40 folks at a time, 3 or 4 different times. And so we're starting to do more of that kind of collaborative sort of training projects, because people go back home, and the people around our military and veterans need to know what they're seeing and what to do about it.
Danita, what about the Zero Initiative?
Zero suicide?
Zero suicide just passed?
It's an aspirational goal, and it's also a set of strategies for health and behavioral health care entities to work toward not having any suicides. And a good bit of it is that everybody coming into care gets assessed for suicide risk, and everyone who's assessed at being at risk has a pathway to care that fits their circumstances. We very, very often in healthcare and behavioral health care, if you think about saying suicide, we pull out involuntary commitment papers, which is not always what people need. And so it's assessing the level of risk and arranging care with that individual to keep themselves safe for the level of risk that they're experiencing.
Okay, thank you. More questions, and Barney, I know you came with a big long question tonight.
I guess this might be for Robert. You know, suicide rates are increasing, and some of the things I've read recently that may be causing some of this is social media, the breakup of the family, even church attendance. It seems as though as church attendance in America goes down, the rate of suicide's going up. What kind of research is being done? What are organizations doing to specifically address some of these issues?
Absolutely. When we think about, let's take even zero suicide for a moment. If we wait until people interact with the healthcare system to prevent suicide, we're handcuffed in a very big way. We're waiting till somebody often comes in to say they're suicidal or come in for something else and us assess it and find a way, and they don't slip through the gaps through primary care or emergency department. So a lot of folks are saying maybe we should look at the prevention of these sort of broader symptoms of suicide, something like social isolation being one of them. And this can be in young adults. This has been supported as a risk factor, but also a great treatment target of getting people connected, fostering meaningful relationships, reciprocal care from both peers and adults that people trust, but also older adults in communities who may have over time lost and their social network has eroded. And maybe that is also a target. Instead of waiting till somebody says, my life isn't worth living anymore, maybe we get to folks when we're seeing them not socialize as much. They're feeling isolated. We're maybe focusing on that to get sort of ahead of the problem.
There is also a link, of course, with the opioid addiction and suicide.
Right.
This is sort of relatively new in the past decade or so, but that is a big thing that's thrust upon us now.
Yeah, some professionals are lumping things like suicide and overdose through substances and the opioid epidemic into maybe a common-ish sort of network of they call deaths of despair. These awful outcomes for our communities may come out from very similar things. When somebody does feel very hopeless and their life is painful, that maybe they turn to substances, and some will also turn to some suicide, some won't, but will continue to use substances to cope with some of that pain. That maybe these things are sort of similar, different, but also sort of similar. And maybe our prevention of all three of those can focus on some of those very common factors.
I know we have some more questions. Alan, Renee, you came here with heavy hearts and strong words. Questions for the panel?
Yes. You had mentioned gun laws or gun safety and stuff a while ago. One of the things that always happens when it comes to anything is they want to start talking about gun laws. Even though Jesse used a handgun to take his life, I don't blame the handgun. Okay, it was Jesse's decision. Do you agree that more safety would be the thing to prevent handgun suicides? And that has to start with each individual, and it has to start at home. It has to be a smart choice to be safe with your weapons. And also, breaking through the stigma is going to be the big issue to lowering suicide rates. We have to break through that stigma. Would you agree with that?
Absolutely.
Yeah. Well, I would love to comment on the firearms issue, because just like everything else, I think I've now continued to talk about that one thing that probably isn't going to do it either. We do see research that in states with stricter firearms laws, that those states will have lower firearm suicide rates generally. But again, it's not to say that even the strictest of states have zero suicides. There's still something going on there. We have data to support that those laws may reduce suicide rates, but also doing things like partnering with gun shop owners and the gun community to have suicide on the mind. In hunter safety courses, can't we talk about suicide as part of this? When we have a friend or a loved one who it might be struggling with suicide, why can't we look to them and say, hey, I can take your firearm for a while if you've said you have thoughts for suicide. I often talk about this, like we don't let our friends drive drunk, so we take their keys. You know, can we promote a culture that we do that same thing with firearms? So when we're talking about firearms and suicide, and the data supports we have to, 51% of suicides in the nation are by firearm, and
68% in Louisiana.
We have to talk about it, but that doesn't mean that the only solution is gun laws and legislation. It's a piece of it, but there's a grassroots community effort, just like you were speaking to.
To our panel, just some brief final thoughts, Danita, starting with you.
I think asking about suicide and reaching out to folks that might be hurting in your life, connecting them to help, is immensely powerful. And don't ever underestimate the power of your presence in the midst of somebody's pain, because it's huge. And the National Suicide Prevention Lifeline, like April said, is a great thing to keep in your phone and share with people that are thinking about suicide, to help access services or check and see what else you can do.
Raymond?
Absolutely. I just hope everyone can leave, and people who are watching at home can take something that this can all rest on our shoulders at some level to do something about that. And that can be, you know, being informed when we make our, when we vote. It can be committing to supporting those around us, whether that's the thoughts of suicide or mental health, that this is going to take collaboration. If there's one thing I've learned with working with folks who are highly suicidal, that collaboration, the ability to say, tell me what you think would help. That help keep you safe. That is such an important thing, and that's all going to be shared by us if we're going to do something about the suicide rate.
Tanja?
Right, and not judging, you know, people who are going through challenges, because life happens to all of us, and people react in different ways, and just letting people know that there is hope, and that if they are feeling that kind of way, that there are different programs that are great programs in our community that can help them, and just being that voice of hope. And like you said, the power of presence is so powerful.
And Cynthia?
I want to tell you, Siri, if you touch Siri and say, I'm thinking about killing myself, they connect you with the 1-800 number. So that's something that young kids will do. And there's help all over.
There is help all over. For now, we have run out of our time for our question and answer segment. We'd like to thank our panelists, though, Mrs. LeBlanc, Dr. Tucker, Ms. Miles, Ms. Elmer, for their insight. When we come back, we're going to have a few closing comments.
Certainly a complicated and difficult topic tonight. And one of the things I was thinking about is this whole idea of social isolation, not knowing how to reach out.
Well, feeling isolated.
And feeling isolated. And the whole idea that it is everyone's responsibility to do. It's a community collective.
It's something for us to all be aware of.
Well, I want to know, and I hope you all want to know more about all the information we can share, and we'll have some information up online. That's all the time we have for tonight's program. We encourage you to visit our website at lpb.org/Public Square and find local and national suicide prevention resources. You may also follow our series on Facebook and Twitter.
August marks the beginning of a new school year, but for many students there's a roadblock to learning because of reading challenges. Louisiana's adults have an illiteracy rate 5 points higher than the national average. Join us next month as our experts share with us programs that can help people discover the power of reading. Thanks so much for being with us tonight.
Good night.
For a copy of this program, call 1-800-973-7246 or go online to www.lpb.org.